Assalamu alaikum, the communication day. First scenario, Mr. William, 36 years old man, has long history of bloody diarrhea, recently developed itching and yellowish discoloration of the eyes and skin. Your consultant ran some investigations and reach diagnosis of primary sclerosing cholangitis. Your task to sit with Mr. William, update him with diagnosis, management plan, and address his concerns. You ready, Dr. Marwa?
Yes.
Okay, here you go.
Hello, good morning.
Good morning.
My name is Marwa.
Hello.
Can I confirm you are Mr. William and you are 36 years old?
Yes, I am.
Mr. William, we are here today to discuss some patients with genetic condition. Is it okay with you?
Yes, doctor. Can you raise your voice a little bit?
Okay, clear now?
Yes, clear now.
Okay. Do you want anyone to attend the meeting with us?
No.
Before starting, can you tell me what you know about your medical condition?
Actually, doctor, for a long time, my health is not good, and I do multiple interventions and surgery, endometriotomy and bleeding come. Even I'm opening my bowel, and recently, for about 2 months now, I started to have severe itching. And when I looked to the mirror, I found my eyes turned yellow color. So I went to the doctor, and he ran for me some investigations, and he told me possibly he will fix this problem. So I came today to know the results.
Okay, Mr. William, I highly appreciate your knowledge about your health condition, and I'm sorry for what you suffered from last days. And I want to be sure that we are all here to help you and provide help as much as we can. Actually,
Doctor, my life is very miserable, and I
I'm sorry.
cannot eat good, and I cannot enjoy my time. I'm very sad and depressed for all these problems. Long time I have this loose motion with blood and anemia, and recently now become itching and become
Uh,
yellowish discoloration.
I can
I don't feel any good and hope in this life, really.
I can understand it is very hard to you with all these painful conditions and abnormal things that happen to you in these days. But as I told you, we are happy to help you and we are ready to give you all facilities and all care. Your results of your the blood tests and investigation you did is with me now. And do you want me to explain it for you?
What is going on, doctor? What is the result of these investigations? What?
The result is
Why I am John? Why I am yellowish my eyes and skin? What is the problem?
I am going to explain all this for you, Mr. Lee. The result reveals that you have a disease called primary sclerosing cholangitis. Did you hear about it before?
No, it is cancer, doctor. This is the only remaining after all this suffering. It is a cancer.
No, Mr. William, it is not a cancer, but it is a serious condition. But it's not a cancer.
Serious?
Yes, it is important to treat this condition and manage it.
So it is not curable? What
I will explain to you. This condition affecting the ducts that connect the liver. I will try to show to you. to make it more easy.
Okay.
Uh, uh,
Okay, doctor, I know.
طيب, if
I'm
is this
listening.
liver, if this your liver, and there is small ducts connected the liver with your gut. In this disease, this ducts become irritated and become have some sort of soreness. This soreness result in scarring of the wall of this small ducts, and finally become more narrow. And this prevents the secretions from liver, that's called bile secretions, from pass from the liver to the gut. And the reason for this condition is the accumulation of this bile salts, or we can call it some abnormal substance in blood called bilirubin and bile salts accumulated in your blood. The accumulation of this substance in your blood causing the symptoms like what you have. May causing bluish discoloration, I mean yellowish discoloration of your eyes and your blood secretions. Also, you can feel your skin itchy and you feel tired, as you said. I'm familiar with Mr. William.
Yes, I'm following. Yes.
Uh, this condition usually have no cause and may associate it with a condition with condition called autoimmune, that the body for unknown reason start to attack itself. And another reason for this condition can come as a complication or association with another disease. And I see in your file that you have suffering from bloody diarrhea for several for a long time, and this may be the cause or the association between there is the association between these two conditions. Are you with me?
Yes.
Our plan, what we will do now is controlling of your primary condition and treating the symptoms you have.
How
By
doctor, how you will relieve my itching, and how you will convert this yellowish discoloration to the normal color of my eyes?
I
How
highly
you will
appreciate your concern, Mr. William. We will involve a team of doctors. Involve doctors of gut, and
what they will do for me, doctor? What they will do
they
for me?
they uh, they will assess your condition probably, and there is some pharmacological, I mean, medications
2
from
minutes left.
pharmacy. You can take it, and other there is some chance for more advanced or more invasive intervention may may you need in
What this
future.
intervention? I did all the intervention, doctor. What is the intervention they will do for
Uh,
me?
the intervention that may you need is to enter to this small ducts by a camera tube connected with a camera, and enter reach to this small uh, tubes or ducts, and uh, put a stent in order to keeping it open and not obstruct. And also there is other medication you can take in form of tablets or oral medications. Do you have any other concern, Mr. William?
I am married and I have two kids now. Is there any risk this disease will transmit to my family?
I highly appreciate your concern about your family and your kids, but this is not transmitted to kids. It's like autoimmune condition, but not inherited. I mean, not transmitted through generations.
Is there any possibility of cancer, doctor, to develop for me?
Uh, Actually, the possibility of cancer is associated with your original disease. There is possible of developing cancer due to your original condition.
If they put this stent for me that you said to me, so now it is curable disease now, and there is no more problem later on.
I'm appreciate your concern, Mr. William, and I am sorry to tell you that there is no curable solution or medication for this condition, but it is
Why, doctor?
manageable.
Why? If you
Because
put a stent and this narrowing will become improved, so it will improve now.
yes,
Why not?
your condition will be improved, but the process itself of scarring and soreness of this duct is still present and still happen. And also, we will deal with this process by giving you some medications called immunosuppressant medications that make the body not attacking these ducts and causing
I
soreness and this narrowing.
I read in the website that if I transmit the liver, transplant the liver, it will radically improve this problem at all. Is that right?
I highly appreciate your knowledge, Mr. William. Yes, you are right. The only medication for this condition is the liver transplantation. You are right for this.
Okay.
Okay.
But I need donor for this problem.
We can help you regarding this issue and see what will how can we help you regarding this.
Okay, doctor. Thank you.
Okay, 2 minutes extra now. I think
Okay.
you covered most of the concern, Dr. Mahi, right? You want to add any concern?
لا خلاص يا شيخ.
Because this
شكراً.
is a new topic, I wanted to cover all possible concern. That's why I added 2 minutes.
Okay. Thank you.
Okay.
Can
Well done, Dr.
uh,
Marwa. I will hear now the comment. Dr. Mahi, please.
Yeah, my comment يعني well done from Dr. Marwa, but she take longer time يعني talking about the Bremer sclerosing cholangitis. No need because it is only 10 minutes. Very short time to explain the disease and the management and addressing the concerns. So no need to take more longer time in explaining and the drawing for the disease and the bile and the liver and the ducts. يعني she takes longer time and she took more than 2 minutes without allowing the surrogate to talk. This is against the communication skills. And also no time for checking the understanding, if you understand she is talking or no. This is number one. Number two, I wanted to ask Dr. Bassem for this, for the clinical judgment in the skill in the communication. Now the scenario written, the management plan, it is not written in the scenario that I will talk about stent and the ERCB and is this is inventing something present for not present in the scenario? Because
Good, perfect question.
Yes, I agree with Dr. Marwa because I am a doctor and I should explain the management for the patient, what they will do for me to relieve this jaundice and itching. This is my
Yeah.
comment.
Yes, you're right. It's a good question. If the management plan not written clear, so you can speak whatever you want to talk, but in short and brief. I mean, for this topic, as a pharmacological option, you have to give a pharmacological option, which is deoxycholic acid, right? For the jaundice.
Let's see.
Yeah.
Itch.
And
Itching.
the itching as well, yes. The second option will be, as Dr. Marwa said, the surgery or stenting, which is also accepted, one of the management plan. And the last, which raised by the surrogate at the end, which is the liver transplant, the definite management. I wished she explained earlier about the possibility to be cancerous, which is real, right, Dr. Marwa?
دلوقتي هو diagnosed already diagnosed إن هو primary
Yeah.
sclerosing
Yeah,
not
I mean,
cancer.
it can be, yes, it's cancerous disease, not
cancer
a cancer. Can be, yes, can be
هو
transferred to
primary
cancer.
sclerosing I think not cancerous itself but the inflammatory bowel can
The
associate with
It will
association,
develop
yeah,
cancer later on.
yeah,
البرايمري نفسه itself يعني
yes,
كان
exactly, yes, it can be. Okay, so you have to explain or to talk about it. There is possibility to be cancer in the future, but don't worry, as always. You have to reassure after giving the bad news. But don't worry, we will follow up you. We will monitor your liver and we will do blood test, we will do scans to be sure there is no possibility of cancer. Okay? This is what I wanted to be covered initially, not at the end, not to be raised by the surrogate. It's better to be mentioned by you. But all option, Dr. Muhi, I agree to be explained, unless they wrote specific management plan in the scenario. For example, if they said in the scenario talk about stenting, so she will take maybe 3 or 4 minutes explaining how the stent will be inserted, pre and during and after, as any procedure. She has to speak about it with drawing and so on. But if it is vague, like in this scenario management plan, so you can talk whatever you want. Okay,
Okay.
go ahead, continue. Any other comment, Dr. Muhi?
No, sir. Thank you. If any one of the colleagues wanted to comment, no problem. We can listen to.
Okay. Anyone has comment regarding this topic? Dr. Aisha, she wants scenario. Okay, scenario what was about primary sclerosing cholangitis. Dr. Marwa, as well, I wished if you could add this possibility or the pathology of this disease as association with ulcerative colitis, right?
I mentioned that I mentioned it's associated with his
But
original
later,
condition.
later, and you said it's unknown cause.
Yes, part is unknown and
Yeah,
part
it's as
associated with.
association of your disease. You already have a disease called ulcerative colitis, since you have bloody diarrhea, and it is one of the association to be associated with what is called what's called the primary sclerosing cholangitis. This is initially. I think also this is supposed to be as breaking bad news. I'm so sorry. The result with me now,
So
and
not cancer.
but there is possibility to be a cancer one day,
But
right?
still not cancer.
I
Yeah,
know,
yeah, it's not
but
mm.
okay, let's check how much the percentage of being a cancer or to be transferred a cancer. And anyone has a document about this or evidence? We can share
Really
it.
search.
Okay. Apart from this, Dr. Marwa,
What?
you did well, but I wanted to be talking briefly, not as Dr. Mahi said, don't waste time explaining. Give him a chance to express, to ask concerns, and so on.
So 5 to 15% of
Okay.
5 to 15% can transmit it,
So
can transform it.
if we said there is, for example, 100 patients, so 15 patients will be being a cancer in one day. So it's not, it's low, of course, few percentage, but it's still one of them. Maybe your patient is unlucky one, he might have this.
Yes.
باسم
I
دكتورة
think
مروة
yes.
Okay دكتور أحمد continue.
Continue, Dr. Ahmed, yes.
Yes, ulcerative colitis is precancerous, it is known, and this primary sclerosing cholangitis associated with cholangiocarcinoma,
Yeah,
and both conditions associated with each other, ulcerative colitis and the primary sclerosis.
yeah, exactly.
Can
Yes.
have both cancers occurring with each other, what I remember.
Yes, I agree with you. Okay, Dr. Mahi, what else you wanted?
I asked concern is it can be transmitted to my kids? She said no.
Yes, he got good
It
concern
is,
and good
it
point
is
to
a
be raised.
familial disease or this is
No,
right answer to
no,
concern?
the answer is with any autoimmune disease. It's not running in family, but your kids having possibility more than the general population.
Like general population or more than general
More
population?
than the general population.
Yes.
Still, the autoimmunes runs in family and not in genetic way or in non-genetic way. So they
Familial
might
disease.
or not familiar, yes, not as a familiar, but still there is possibility to be having the disease in the kids. Okay.
Okay.
Any other comment or concern or doubt or suggestion? Okay. Your scenario, Dr.
يعني رغم
Mahi?
انه بس short يعني short 10 minutes but يعني checking the understanding of the surrogate
Exactly.
is important.
Yes,
يعني
it's more important than talking and giving information. This is what I realized. They want from you to listen to him and to address his concern, to answer his questions, rather than talking to him and explaining a lot of things. Unless you will say something related to the task. In this task, explain the disease, the management plan, you have to give them, but in short and brief way. Don't talk in details. Okay, and this is not curable disease as well. As Dr. Marwa said, it's difficult to be controlled. Yes, some stent will help, but still the scarring will be ongoing. Even it might be precancerous or it might be transferred to cancer. And low percentage, you can say, but it still happened. Okay,
She
but
asked about
always
alcohol in this scenario or no?
no.
I can't ask
Yeah,
any social.
she didn't have any
Also,
time to ask. But
Should
perfect
ask
point.
the
Yes,
alcohol.
yes,
Yes.
you're right.
To
But
just moderate and to be the limit, to the
yes,
limit,
yes,
and avoid binge drinking, and
perfect.
making some days free from alcohol during the weeks, like this.
Yeah.
Also, here, I don't know, but for management plan, I think he already did the MRCB here in scenario or no? They don't.
ARCB. She mentioned ARCB.
ERCB done or
No,
the
no, it
MRCB
wasn't.
done?
Nothing done.
How they diagnose it?
Whatever how they diagnose, but it's diagnosed. So it's one of the investigation, right? They wrote.
I think done, yes.
Yeah,
To diagnose it, I think done.
exactly. Yes.
Or they can be, or only done the
But don't say it,
markers.
Dr. Aisha, unless
They
it's
write it, they write it,
yeah.
yes.
Exactly.
دكتور عائشة primary sclerosing cholangitis can be diagnosed by ERCB or MRCB.
Both, yes, both.
So,
Both, yes.
but the intervention by ERCB.
Anything intervention will be delayed till if you can't get the diagnosis with the other thing less dangerous or less invasive, yeah.
Yeah, ARCB only for intervention. It's diagnostic and therapeutic. But MRCB is only diagnostic too.
anti-mitochondrial antibodies.
Sorry?
Anti-mitochondrial antibodies.
And you draw, Miss Dr. Marwa, about this for explanation?
I can't draw.
Reach your voice.
At all? At all or this scenario only? At all? Or this scenario only you can't draw?
In this scenario only, I tried for So the men
Mm-mm.
don't do this.
I think only draw the liver and inside it the gallbladder and the some channels coming from it.
I tried my bin, but not know what.
Because they said if procedure or disease, they waiting for you to draw.
Yeah, I agree with any explanation, any procedure you can do.
I tried, but I failed.
Your voice, I can't hear.
I
Yes.
tried to draw, but I failed. My bin didn't show on the screen.
It's okay. Put it in your mind to do it in the exam. You have a paper, you have a pencil, so you can write. You can draw.
Mhm. But here we will talk about the medication to relieve the itching, yes?
Yes, suppose
Mhm.
there is pharmacological option or medicine, and also there is possibility to be intervened by surgical option. And the last option, which is a definite treatment, the liver transplant. But you can say it's so early to talk about it. We can arrange another meeting.
But if he asks like that, it is treated or cured, I think we can say it is cured only with liver transplant,
Yeah, this is the only
like
curable.
that. Mhm.
Yes, or this is the
Like
last
thalassemia,
definite.
when they bring thalassemia also in communication, they like the surrogate ask,
Stem
uh,
cell transplant.
yes, they
Mm,
ask this question. And the only cure for this condition, the stem
yes.
cell, but you will not talk about, but just if asked the question, it will be wrong information if you said it's no any cure.
Okay. You mean as a curable plan or curable option? There is the same as
We
for
can say like
ulcerative
in most
colitis.
of patient, we manage the condition by medication, but the definite cure for this
Mhm.
condition is only by
Yes,
transplant. Yeah.
yes, yes.
But it is
You're right.
final option and in the stage
Exactly,
disease.
yes.
Yes.
The same as for ulcerative colitis, the colectomy.
Cure, yes, yes, you are right.
Okay. Thank you, Dr. Aisha. The next scenario, Mr. Ali, 70 years old, known case of bladder cancer for 5 years, and he's on chemotherapy for that. Before 1 week, he became drowsy, confused, and anuric. In spite of catheterization, there is no urine output. Urea and creatinine are very high, and nephrologist decided nephrostomy tube. So discuss with his son, Mr. Ahmed, about nephrostomy tube. Dr. Mahi, I will give you 1 minute. If you want more, it's okay. Okay. Any doubt for the previous scenario or any other scenario?
Dr. Mahi said takes long time to initiate. Can you explain in short way?
Sorry, Dr. Marwa, we can't hear you. If you can be closer to your phone.
Can you explain the primary sclerosing cholangitis in simple way?
Yes, scarring of the liver around the channels of the liver, and it happened as association with ulcerative colitis. I guess you know about the ulcerative colitis, or you want me to explain about it? Because he's already known as supposed to be.
Mm.
And this is the way also if your patient is having symptoms with diagnosed disease, either to tell him you want me to explain, or you can assume that he knows about it. But for the new task, which is the primary sclerosing cholangitis, you can say it's one of the association and complication in some patient it might happen, and the mechanism, as I said, scarring around the channels of the liver. That's why there is toxic substance called bile. It will build up in your blood, and it might be deposited in your liver, in your skin, under the skin, and in the eyes. That's why you looks yellowish than expected or than before. This is the most easy and simple way to explain it. Our aim is to reduce this substance, it's toxic one, and to help the liver to drain it. As you said, by option, surgical option, the stent, it might help to drain, and the other option is the pharmacological or medicine, some medicine, it might help to chelate or to combine this and to get rid of this substance from the blood and from the body itself. Clear, Dr. Marwa?
Yes, sure.
Yeah. Then you can say the complication, as I said, the complication of PSC sometimes and in a few percentage, it might be transferred to cancer. And always, always reassure when you do breaking bad news. So cancer, it will be shocking for him. I'm so sorry for this news today, but don't worry. Be sure that we will follow up you. We will monitor you, and from time to time, we'll try to do some scans, some blood tests to be sure that you don't have the possibility to have a cancer in this way. Okay.
Okay. طب if you said the colectomy is one of the management plan for
The what?
ulcerative colitis. Colectomy. صح؟
Colectomy for ulcerative colitis. I'm talking in
Yes,
general, not in this scenario.
but in this scenario, not affecting the sclerosing cholangitis.
I guess if you control also the ulcerative colitis, it might control the primary sclerosing. I'm not sure actually. I don't know how it can be related. But at least if he asks you about the original disease, the ulcerative colitis, you can talk about the cure. But now the task is about primary sclerosing cholangitis, so don't go deep with the ulcerative colitis. Okay. But you can give him red flag at the end, safety netting, that if you feel this substance being more clear or obvious on the skin or in your in your eyes, if you feel tummy pain or discomfort in your tummy, particularly the right upper part, or you feel your water work being more darker, or you feel itchy more than expected or more than usual, don't hesitate to come to us immediately. So always at the end, you can give this safety netting for any disease, not only this disease. Of course, if you have time. That's why it's important to try to be short while explaining any disease. Why? Because at the end, you can give some red flags or safety netting, which can help the patient to know when he will contact you back. Plus the appointment and follow-ups. Of course, you can assure him at the end, we will give you follow-up for the next meeting or for the next appointment with our gut doctor to assure you or to update you with the management plan. And to monitor also this substance. Okay.
Yeah.
Is it clear now, Dr. Marwa, for you?
Yes, please.
Okay. We can start now, Dr. Mahid, the scenario.
Okay, sir. Okay.
Nephrostomy, okay? Here you go.
Hello, good morning. I'm Dr. Ismail, senior house officer of the on duty now. Am I talking to Mr. Ahmed? And you are the first of kin for Mr. Ali, 70 years old?
Yes, I am.
Today we will discuss some issues related to health of your father, and I will address your concern. Is that okay with you?
Okay, doctor.
Initially, Mr. Ahmed, may I ask you how much do you know about your father condition?
Yes, doctor. My father is an old man who is 70 years old. He suffered from bladder cancer since 5 years, and he taking chemotherapy. But I can't see any improvement in his condition. In this last week, He become drowsy and confused, and they said there is no urine output at all. I don't know why this happened to him. Is it related to the bladder cancer?
Okay, I appreciate your asking your question, Mr. Ahmed. May I ask you, what is your expectation from our meeting today?
I had no expectation. I come to tell me what is going with my father.
Okay, Mr. Ahmed. You know, Mr. Ahmed, after the team assess your father condition, they found that, as you said, no urine output and the accumulation of toxins in the body make him drowsy and assist, يعني yeah, disturb his condition. So the team management is inserting a tube named as nephrostomy tube. Have you ever heard about this tube?
No, doctor, I don't know what this is.
This tube is a type of what is named as palliative treatment for this obstruction for the urine pathway. Already he has a tube inserted in the urethra to remove the urine, but it cannot drain this urine. So the team decided that the best interest for him is this nephrostomy tube. This tube, I will explain for you. It
Doctor,
inserted.
I can't understand. Doctor, what's mean of palliative? What is mean of palliative and what's mean of urethra? I can't understand you.
Sorry for this word. Urethra means urine pathway. Urine
Okay.
pathway from the kidney down to this bladder, then to the outside. We will insert this tube directly to the kidney. This team who will do this operation are skillful. They do this many times before. And they do numbness of the skin from behind, from the back. Then they will insert this tube directly to the kidney to remove these toxins and this urine. But before we do this operation, we will run some blood tests and imaging to make sure that your father is fit for this operation and to avoid as much as we can any complication can be happen. And this operation is done under a complete aseptic technique. Okay?
Okay, doctor. He will be cured after this operation?
What?
He will be cured after this operation?
No, he will not be cured. This operation, the aim of it to relieve this obstruction for the urine pathway. This is the main aim. And to remove the toxins from the blood and what the kidney finish from the filtration of the blood to be removed outside. Okay?
For how long, doctor? For how long this tube will be inside his kidney?
This will be decided by the team, but possibly it will be inserted for longer time until we fix for this cancer of the urinary bladder. Okay?
Okay.
After the operation, your father will stay in the hospital for several hours to make sure that the operation is succeeded and no complications happen. Then we will discharge him to the home. And if he feel any rise of body temperature or obstruction to the tube or anything, you can seek advice, and I will give you the hospital contact number for this issue. Okay?
Okay, doctor. Okay.
May I ask you, Dr. Ahmed, Mr. Ahmed, do you have any concern?
Yeah, no, doctor, no. You can ask what you want.
Okay, Mr. Ahmed. I will give you some brochures and the website to read more about this. But I wanted to tell you that we need from you written consent for this operation to be done. And I'd like to tell you that some operations may be failed, complications, infection, and failure of the procedure itself. Okay?
Doctor, you make me try on this
No.
procedure. I need time to rethink this before
You
sign the consent.
take your time to read about it and ask also. Then and you are feel free even after consent, as long as no operation done. You can withdraw from at any time. But I wanted to make assure you that complications it is less likely to do. It is about 1 to up to maximum 5% of the cases for the failure of this procedure. Okay?
Okay.
Do you have any other concern, Mr. Ahmed?
No, I don't have. No.
Okay.
Social, doctor, not ask. Social.
Dr. Mohi, you have 2 minutes.
May I ask you some questions, Mr. Ahmed?
Sure, doctor, you can.
Who is dependent, with whom your father is living on?
With me, doctor.
Anyone dependent on Mr. Ali?
No, no one.
Okay. Do you have any, do you need any social support or
I am okay, doctor. I am okay, thank you.
Yes. Thank you. خلاص كده يا دكتور، بس مفيش حاجة تانية كده.
You are so honest. Try to find anything to talk about. The palliative. You finished?
Social.
No,
Smoking.
no need for smoking, and he's already on chemotherapy. Something else he should ask in this scenario. What do you think, Dr. Mahi? Patient is confused.
Yes, patient is.
Advanced stage of cancer.
Yes.
What do you think? 1 minute. Advanced
Directly, yes.
Yes.
I wanted to ask you, Mr. Ahmed, for your father, he has any living wish?
He didn't mention.
Hmm?
He didn't mention anything like this.
Any lasting power of attorney for him?
What you mean, doctor? What you mean lasting power of attorney?
That he mentioned name of if close person for him, he can take decisions in behalf of him if he lost his capacity or become drowsy.
He didn't mention, but I am the one who, the closest one to him. I am his son, and I am the one who taking the decisions usually.
Okay, Mr.
Okay, I think time is up. 3 seconds to 1. Okay. Dr. Marwa, you can comment now.
Okay. First comment about Dr. He mentioned this palliative and didn't explain the palliative. What mean of palliative? Another thing is not maybe not palliative, because it's deterioration due to the obstruction, not due to the cancer itself. After resolving or opening the
مش سامع يا دكتورة، معلش مش سامع.
after the deterioration of the lesion, not because of the cancer, not the cancer itself, only the obstruction.
Yes, I see.
The obstruction is because you said it's palliative. He will continue his chemotherapy and active medication as usual, but this only to relieve the obstruction.
Yeah,
And him,
I told you, no, I told you this deterioration because of obstruction to the urine pathway. I did not mention cancer at all. I said these toxins accumulate in the blood due
yes,
to obstruction of the urine output. So
you
we
said
will,
palliative.
then you said to me after insertion of this tube, he will be cured. I tell you no. It is only a palliative to relieve the obstruction and the removal of the toxins.
Okay, but also you didn't explain what's the meaning of palliative.
Yes, you are right. I should say palliative means to yeah, temporary solution for the problem. So
Yes, yes. Another thing, when I said I need time to rethink, you should tell him there's you can take sometimes, but time is very important. We have to do this procedure as soon as possible because if it will continue, maybe permanent
I tell him, yes,
deterioration.
okay, you can take your time to ask.
But يعني
But
try
this
to be as soon as possible.
it is a type of pressure on the surrogate. If I said the time is important and you should quickly think like this. But I tell them, okay, you can ask and you can read. Then you will update me by your opinion for this.
But يعني not give him open time because the patient may be permanent renal failure or may need dialysis.
Okay, I have here comment about the consent and thinking and so on. What do you think?
Okay, but
Yeah,
Yes, he should not think.
yeah.
It is a life threatening condition.
Not only life-threatening, the patient, we already had a deal before that any procedure for any patient lose the capacity, no consent will be secured by the next of kin. So it might be signed as the best interest of the patient by the medical team.
Yes.
This is by NHS. If someone can remember the scenario of lumbar puncture and the patient get confused and we have talked with his father or her father to talk about lumbar puncture. So we updated ourselves and the meeting that no need to get consent from the father. Since she lost her capacity, we will do it in the best interest without just informing the next of kin. No need to get consent from him.
Yes,
This is as per NHS.
yes, I know this here. I
Okay,
know
you
this,
know.
but I
Yeah.
did not.
this lumbar puncture, what was the case for?
Meningitis, suspected meningitis.
Meningitis
Yeah.
for diagnosis here?
Yes, diagnostic. Even therapeutic, it will not be indicated to sign a consent. So you will explain just informing the patient's son, like verbal permission, but still the capacity lost, so no need for the son consent. Unless the father is able to sign, so the father will sign. If the father is there and you have to talk to the son, so you will talk to the son and you will tell him there is a consent form, the father will sign it in this way, okay? But if not, so it would be done by the medical team as best interest of the patient himself, okay?
Yes, the team decision of the team is
Exactly.
more powerful than lasting power of attorney and the first of kin.
Of next of kin, yes. Next of
But
kin.
not powerful than the living wish. If the
Exactly.
patient
Good question in this
fine.
scenario to ask about living wish or advance directive. Why? What do you think, Dr. Mahi?
If he write, if written in the file, his living wishes that if he lost his conscious level, he don't want to be treated by any invasive
Perfect.
anything.
And
So
if
At the,
deteriorated, what he
can-
what? He
the
may be
team
signed
cannot,
no CBR. Yes.
the team cannot be inserted.
Because this patient can deteriorate at any time. So you should ask, he may write no CBR for him like that.
exactly, not only CPR, Dr. Aisha, even this procedure,
Advanced, yeah.
this
Or even-
procedure, it won't be done. as Dr. Muhi is saying.
Yes, it is something hard because to mention something by name.
What is it? The
He will
procedure?
mention something in advanced directive by name, this
No,
procedure by name.
he will say, or it will show that I don't want any intervention.
Yes.
I want, for example, I want to die in peace. Don't break my body or don't insert any tube. So it will abort all this discussion, but it won't be in the exam because this is the task of your scenario. It cannot be against the living language, but you have to ask about it.
Yes.
Okay. Any other comment? Yes, Dr. Marwa, continue. I interrupted you.
No,
What what other point?
no other point.
No, still بصراحة يعني I did wrong يعني very bad in this scenario. My performance was very bad.
So
Because
what do you think, Dr. Muhi?
yes, والله I did
If
very
you
bad.
yes, it's not very bad, but you have a lot of jargon you have to correct.
Jargon, yes. Urethra.
Yes, jargons, a lot of jargons, really. The bladder, the urine, even the urine. I saw in one of the groups, some doctor have a comment or written a comment in one group. I cannot remember what's ago. That they commented as the jargon. She talked and she said urine. So they consider the urine as jargon.
But the surrogate said to me urine. Yeah, so yeah.
Even the surrogate said to you urine. Be simple while talking about what you are talking. For example, the urinary system. So water work.
And suppose in
Unless
the exam he will not say, so
exactly.
try
Yes.
to train yourself. Yes.
Yeah. Plus, it might be the only situation you can talk in all medical and all jargons freely if this patient, for example, told you, I am a nurse, I am a doctor, I can understand. So
I heard also Dr. Bassem in this case also don't
really,
use because you didn't know the level of this patient or how much he know. Yes, I said it is recently Dr. Tariq. I think he did the scenario of needle.
yeah, needle stick. It was a nurse.
Needle stick. Yes,
Okay.
and he said don't speak even with nurse or with medical because
Good.
you don't
Okay.
know what extent of information she has. And
Yeah.
maybe she forgot the medical therapy because she practiced maybe in other
Yeah.
facility or like that. So save yourself and
Yes.
speak
Exactly.
in the normal
Non-jargon.
language. Yes, non-jargon.
Yeah, and I guess also you don't know the examiner mind. He might be tough, he might be toxic. So even you are talking to the nurse, he will comment that you are talking with jargons. So please try to be simple, Dr. Muhi. Try to train the all coming days. Every day you have to do two long, for example, and two communication. Whatever the partner, you have to train. Okay.
عارف انا اقول كلمة يوريثرا اقولها باللغة العادية ايه وكلمة
It's water work passage.
And draw, Dr. Mahi. If you draw a lot of
Yes,
things, you will find
will
it
be
simple
easy.
with discussing.
Doctor,
Yeah,
you said also urethra from kidney to bladder.
ureter. He mean he ureter.
You start, yes, you start from the kidney. It's from the urine bag and until outside.
ممكن يورين باك صح الله يكرمك.
Yes. Yeah.
يورين
Yes.
And firstly, you should explain the condition because she said, I don't know, my father don't bring any water during the days, the past days. So you will say there is here, we think that this passage is closed. So no, the kidney can't work. So we should replace this passage by other passage. So we need this procedure for urgently and explain the procedure completely as we know before and during and after together, and every part of when you discuss you will ask here, this is clear, this sound good, or any question like that, so you will finish all parts of procedure because I think you finish some and after that you mention the complication at last. She already I think forgot about so you make it as package, so we will not forget anything. Before the procedure, we will make sure that he is fit for the procedure by some test. During the procedure, we will lie your father like that, and we give something local to numb his skin. He will not feel pain. We will introduce this tube by some help of scanning of the this video, or what is this ultrasound? We said what is this? We call what ultrasound?
Imaging scans.
Jelly scan. Jelly scan.
Jelly scan. By jelly scan, we will apply this tube to reach the kidney and to help your father to new pathway to this obstructed pathway. This all this withdrawing. So you will monitor to her on the paper, and will be easy for her to understand what you said, because it is complicated things. If you will not draw, she will not understand. She don't know where is the kidney, how you will enter it, where you will put the tube. So you should mention this, because she will feel scared that you will pass something through the kidney. You will said after that there is any procedure have some bad effect. We should tell you about, and it is rarely happen, but you should know it is like that, and but we can manage. If it happen, we can manage it rapidly, and we have a clever team doing that many times, and they successful in manage anything will happen, and it's rarely will do, but we need this procedure for urgently, and the benefit we will take from it is more than any harm we expect that is rarely will happen. After the procedure, we will let your father rest, and we will monitor if the procedure succeeds, if he has any pain, if he has anything, we will monitor him. We suspect that after the procedure, your father will gain his conscious level, and he will be better than before. If he asks you, it will cure him. No, it is part of his to relieve his this obstruction or this blockage in her water work. But after that, he may need this tube for life.
For long term, at least, because his life expectancy, it will not be long.
Mhm.
And perfect, mashallah, Dr. Aisha explained everything. Remember always, Dr. Muhi, before, during, and after, in any procedure, in any scenario, if you remember these 3 points, you will at least consume the 6 minutes explaining and fill all the gaps for the procedure, plus adding the consent. In this scenario, of course, as we said, there is a consent form, but it will be signed in the best interest of the patient. But
Yes.
as Dr. Aisha mentioned before, you did, I think, most of them. The blood test to be sure there is no problem in his bleeding or in his blood to be thin.
Just stop in between and ask about if it's clear. You need any
Yes,
explanation
exactly.
more, and draw what you mentioned. So it will
Exactly.
be. And also, I don't know if I didn't make sure that you ask if she is the next of kin at the
Yeah,
at the
he
start.
asked. He
He
asked.
asked.
He asked
Okay.
initially, yes. He asked.
Mhm.
And he asked about the introduction, the expectation, which is missed by
Yes,
Dr.
this
Marwa, I think.
point. Already
Yeah.
he mentioned to you what he wants. So I think it is no need to ask another question. What is your expectation?
What I missed,
Because
If,
doctor?
already when he asks you what you know about father, you tell him at the end, I need to know what is will happen to my
yeah.
father, what is his condition. So this is the concern. No need to give another
No,
question expectation, I
it's okay,
think.
Dr. Aisha. If he asks, she might tell him something in her mind or his mind. For example, will my father will die? Will my father die?
Mhm.
So he
Maybe
might
yes.
give him another question. He can address it initially, and he got the mark for this question. So it's okay to ask this expectation for any scenario. But
Mhm.
again, as Dr. Aisha draw and asked to draw, yes, better to draw before and during and after. The during, you mentioned 2 things, which is numbing the area by medication, using a needle, and by ultrasound, which is called jelly scan. This to be more safe and to be target to the kidney and the tube will be inserted with less complication. Don't mention any number. Don't say it's 1 to 2, 3, 15. You don't know. It might be wrong for you, and it might be wrong as a judgment. The examiner might comment on that. So few possibility. It's very less to have this complication. Why? Because our team are expert doing this skill many times for other patients. After the procedure, the patient or your father will stay some time under monitoring to be sure that nothing happened, no complication. And when he's fine, he can go home. But of course, after checking his, for example, his condition, because you don't know why this father in the hospital now. Is it because of the uremia or just for the insertion? Okay. So you can say after the procedure, we'll be sure that he's fine. And after that, is if his condition is suitable, he can go home. This is regarding the post. The complication, you have to mention bleeding and injury to nearby organ. And the other one, infection.
And
Bleeding,
failure.
infection, and injury.
Failure.
And failures. There is failure rate for any procedure, as any procedure. There is possibility to be failed. The last point I wanted you to, yes, the nurse will teach you how to deal with this tube. Dr. Marwa, excuse this sound for me. Yes. Okay. The nurse will teach you how to deal with this bag. Why? Because the nephrostomy tube will drain urine, and it will be connected with the bag under the clothes, of course. So we will teach you how to deal with this. And anytime you feel it's not draining urine or water work, there is redness in the skin around. This is as a red flag. Always remember the red flag, Dr. Mahi. It's very important, and something give you like the most important care you provide to the patient. If you feel redness, you feel not draining well, the urine change in his color or in its color. So please ask for medical advice, or you can bring your father to us. Then let's talk about the advanced directive and living wish. You have to ask why, because this patient is feeling drowsy and he lost the capacity. He might have some advanced directive that I don't want intervention anymore. I don't want to be at the hospital anymore. If he mentioned to you any of this, you can tell and reassure him that we respect his wishes, and we can apply it or update the team about it. The last point is about lasting power of attorney. You will not ask in this way, who's the lasting power of attorney? It's a jargon. Even the advanced directive, the patient or the surrogate might tell you what you mean by advanced directive. So the best thing to say, did your father nominate anyone to take decision on behalf of him? Either yes or no. If no, it's okay. If yes, please update us about him. And advanced directive to be asked as, did your father documented any wishes in the court or any written document what he want to be done for him regarding his medical
Okay,
decision?
but the
Yes,
lasting power of attorney here, if he said I am the lasting power of attorney and I don't want,
I
يعني
don't
it's
want this
better,
decision. Yeah, so will be
يعني better not to
first.
ask from the
Okay,
start.
better not to ask. But if you asked and he said, no, doctor, I don't want this procedure, so we will talk about this with legal advisor.
Mm.
It's good not to ask. Yes, I agree. But it's okay if you ask. Always, all of us asked these two questions together, advanced directive and lasting power of attorney. If you ask it, you can tell to him, we will address this with the team, any possibility to cancel or if it will not be done. So at least skip this point, because if he start to argue with you, you will not finish this topic.
Also, we can talk about the importance of this procedure, and he may,
Of
if
course,
it
this is
didn't done,
already
we
they
need.
done. already done by Dr. Mohi. He mentioned to you the toxin is built up in his blood.
On dialysis, he may need dialysis
He
or
might need
will need.
dialysis, but I don't think they will put him on dialysis because of the cancer and advanced cancer. So that's why the introduction is very important. What do you know about your father condition? You want me to explain about him and his condition. Why? Because the prognosis and the outcome here is very important. Dr. Mohi mentioned the palliative, which is good in this scenario. He's receiving chemotherapy, but still his condition is not improving and he has obstruction. So anything may be provided to this patient, it could be as a term of palliative, supportive, just to, it's not curing the patient, it's just to uh, pass the obstruction or bypass the obstruction, and it might help him to regain his conscious level. However, it might happen again and it might be deteriorated, it might be infected, it might be obstructed again. But now the task is nephrostomy. So you will talk about nephrostomy as a procedure. So I guess this scenario, it will be termed as procedure. Explain about procedure. That's why it's important, Dr. Mahi, to draw and to make the steps of before and during and after. Okay.
Yeah, Dr. Bassem, I feel that I was good in the start, but unconsciously, I feel myself stuck with some terms, and I feel that I say jargon. When I said urinary bladder, and
Okay.
when I said urethra, I feel I lost the scenario. So I depressed, and you feel that
No, no.
I stop talking. You
Yes, yes.
remember?
Yes, I know,
I lost
but
the
don't do
scenario
that in
already.
the exam. Please continue your talk. Don't
Suddenly,
stop
but
at all.
how I will say urinary bladder,
Yes,
I
I will
didn't
tell you
find
now.
any word to say. So I said urinary bladder.
Always imagine yourself talking to your friend, not in medical field. Okay? Imagine this is the surrogate. Whatever you say, try to make it, even you mention as jargon, correct it and explain it in non-jargon way. It's okay to say it, but to explain it, this is a must. For example, as Dr. Aisha said, or Dr. Marwa, I think, whenever you mention urinary bladder, oh, it's a bag containing the water work at the end before the water work will go out of the body. Easily. I didn't prepare it, by the way. Okay. The kidney, of course, he knows the kidney. Kidney, one of the organs which you filter the toxin, as you said, to be getting rid this toxin from the blood. The ureter, it's one of the tubes connected the kidney to the bladder, which is the urine bag or the water work bag. You mentioned urine, say this is the urine is the water work. The urethra, it's one of the tubes which get out the water work from the bladder, which is the water bag, outside the body. Anything you can do it as jargon, but later on explain it. They cannot say or they cannot comment that you said jargon. Once you comment or you explain it in non-jargon way. But it's much better and it will be the optimum if you say it from the start as non-jargon way. Clear? How to do this?
Yes.
How to do this? By training on every scenario. Now you did this scenario with Dr. Marwa. Try to do it with another partner or in another session or with the one partner in your duties or whosoever. Try to repeat the scenario particularly, and you will find yourself that you solve this problem. You correct all the jargons. You can repeat this scenario tomorrow, after tomorrow. This is how to overcome this problem. This is the only way. If you left yourself till the exam, believe me, you will do all jargons. But if you train from now onward how to fix every jargon, you will be able to fix it, whatever the scenario. Because you are supposed to be explained this in one scenario in one day. But if you left yourself, okay, I will wait for the exam, I think you'll be surprised with a scenario which you didn't practice, so you might have practiced it with a jargon. This is the only solution, Dr. Mahi, by the way.
Yes.
Don't be depressed. Don't give up. And will say, okay, I will. By the way, you might be very lucky if you have in your exam a scenario which you practiced already 2 days prior to the exam, or 3 days, or 1 day even. But I guess the last day before the exam you will not do anything. So 2 days or 3 days before the exam, if you do scenario, you might have it in the exam and you will pass this scenario easily. The most important scenario you have to do and to train on the medical error. Most of the exams and diets, at least one of the scenarios will be medical error. If you are lucky, you will have one of them medical error. The other scenario either explain a disease or explain a procedure, or for example, medication counseling. But medical error, it's a very high yield and commonly coming. At least do them in a daily basis, the medical error scenario. And of course, you have to know how to fill the gap and the steps of medical error analysis. You have to do that. You know, in the university, some doctors who's studying the whole book, and in the past, I mean, and some doctors, maybe this is the achiever, the top achiever, الأوائل, just reading the questions of the last recalls, reading the question, answering them. At least they will find most of these questions in the exam, and they will be excellent or very good. But some unlucky doctors like me, by the way, I don't prefer to fill and to just revise the questions. I prefer to do perfect analysis and revision and so on. That's why we are good, not excellent. So what I mean, if you didn't study all things, at least study the recalls and study the most common scenarios. You might have 6 of them in the exam, and pray for that to have good luck. If you have 1 or 2 scenarios you didn't practice them before, either in long or communication or short, you might pass the whole exam, by the way. It's not important to be passing the whole stations. You might drop in 2 stations, but you might pass the exam. In general, I mean, okay? Okay, Dr. Mahi, at least you are doing your best nowadays, practicing and so on. I will give you also opportunity tomorrow for the short clinical.
Okay, sir. Thank you, sir.
Most welcome, Doctor. You deserve, inshallah. Hopefully, you will do it because you already work on yourself. Really, it's inshallah, it comes from Allah that at least you did your best. Don't be depressed or frustrating. I can feel that, but it's not the time to feel this. Do your best from now till the exam. Inshallah, you will have at least most of the scenarios you practiced the days before the exam. And believe me, you can pass with this. You have any question?
Thank you, sir. ربنا يسهل إن شاء الله.
Inshallah. Okay. Any question, Dr. Marwa, or any comment you want to add?
No, doctor, thank you.
Dr. Aisha?
لا.
Anyone has comments or question?
بالتوفيق دكتور محي. You're excellent. Really, you will pass إن شاء الله this time.
يا رب.
Inshallah. Okay. If no question, we'll see you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
السلام عليكم.